Hi and welcome to Infertility Dialogues. I'm Supriya and this series is my attempt to start conversations around the taboo topic of infertility. So today I'm going to talk about something that's actually a very pertinent question that I came across in one of the forums that I'm part of, and that's about how safe is IVF, right? Like any other medical procedure, of course, there are risks associated with assisted reproduction. So I'm going to talk about a few of those, but please keep in mind, I'm not a medical practitioner. This is just something that I've experienced and read about. Uh, and I would recommend that you do take your doctor's advice before taking any decision or any action. So, as some of you follow this series know that I have undergone an IVF procedure multiple times, 6 times to be exact, which included egg retrievals and embryo transfers. Of course, none of which resulted in a pregnancy for me. And ultimately, I had to opt for surrogacy, which finally gave me my baby boy. But in the process of undergoing those IVF treatments, I lost my gallbladder. So, yes, that could be one of the issues that you might face if you're undergoing an IVF treatment, because the hormone treatment that IVF is thickens your bile and increases your chances of having gallstones. And if your gallstones become really painful, or if your gallbladder is swollen up, then for me it was an emergency surgery that they had to do to remove the organ itself. So overall, IVF is a pretty safe treatment, other than the hormonal side effects, which could of course result in bloating, it could result in weight gain, and the general feeling of mood swings and stress and depression that come with it. It's like being on an extended PMS for most of us. But other than that, it's usually a safe procedure to follow. And of course, you need to go to a good clinic to make sure that your doctor knows what they're doing. One of the risks of IVF is it increases your chances of getting ovarian cancer. So if you're undergoing multiple cycles like I did, it puts you in the high risk category. And they say like almost a third of women are at a higher risk of ovarian cancer if they undergo IVF treatment. So there's some research around that topic, but of course it's not an immediate impact. But yes, later in life it might happen. So that's something that you need to consider. The other thing, and that's something that's more common, is ovarian hyperstimulation syndrome, or OHSS. Most of the women end up getting it because it's the hormones are given to you, the gonadotropins. The idea is to stimulate follicle growth, right? And sometimes that follicle growth becomes too much, and you can experience stomach. It's bloated. There's a lot of pain in lower abdomen, and several other symptoms that are associated with OHSS. Usually, it's mild and can be just taken care of with few drugs and very easily managed. But in some cases, if there's a extreme OHSS, it could even be fatal, though that rate is literally negligible. But that's something, again, if you're very, very sensitive to fertility treatment drugs, then you need to be cautious about and might want to read up on. Few other things that could go wrong with IVF are ectopic pregnancies, which is when the embryo is implanted in the fallopian tube itself and doesn't drop into the uterus. So that's not going to grow into a baby and has to be terminated. So that's one of the things that is a risk. The other thing is the risk of multiple pregnancies, right? So especially in India, it's okay and legally allowed to transfer 3 embryos at a time. And in case all 3 implant, it becomes a risky pregnancy for the mother and for the babies as well. So in that case, a lot of clinics also offer selective, you could termination. So you could possibly, or in fact, in most cases, they recommend that you have to terminate one of the pregnancies. So then you get twins instead of triplets, because a triplet pregnancy is that much more riskier. So that's another thing that you need to consider. But other than that, pretty much in my experience at least, it's a very safe procedure. I haven't really heard any horror stories either of IVF going wrong, except the disappointment that it might not work for you given the very small success rate that it has. So yeah, that's my 2 bits on whether IVF is safe and what are some of the things you need to consider before you go for treatment. But like I said, please do consult your doctor. I'm not a medical practitioner. This is not medical advice. So till then, if you have any questions, please let me know. You can follow the channel to subscribe for more videos around IVF, and I will see you next time. Thank you.